Hi, Sophie. Have you got a second? I need to go over the changes to the patient follow-up system for speech therapy cases.
Sure, Mihira. What's different now?
Well, traditionally we booked reassessments automatically at 6 weeks. Now, only high-risk patients, like post-stroke or head trauma cases, will be scheduled formal reviews. Others will be contacted at 4 weeks by phone, and if there's no flagged issue, no in-person session will be booked.
Okay, but didn't we move to longer intervals before because of resource shortages?
True, but audits showed delayed intervention worsened outcomes, especially in patients with early mild dysphagia. So, even though resource pressure is real, the new system prioritizes clinical need over blanket timeframes.
Got it. So, the patients without red flags may not even need face-to-face review.
Exactly. It's about identifying who genuinely needs intervention earlier rather than letting everyone wait based on calendar dates.
Makes sense, Mihira, though it's another adjustment for the ward nurses to track.
I know, but catching deterioration sooner could save a lot of escalation down the line.
Mihira, it is wonderful to see how well you are progressing in your recovery. I have some very positive news to share regarding your wound. After a careful assessment, the doctor has confirmed that your skin has knitted together beautifully and is now strong enough to hold on its own. Typically, stitches have finished their important job of supporting the tissue after about 7 to 14 days, and leaving them in any longer could actually irritate your skin. Removing them now is a natural and necessary step to help your body complete the final stages of healing. While the stitches are gone, the area still needs a little extra kindness. Please try to keep the site clean and dry for the next few days to prevent any irritation. If you can, keep it lightly covered with a fresh bandage to protect the delicate new skin from rubbing against your clothes. It is also important to continue your antibiotic treatment exactly as directed and use paracetamol if you feel any lingering discomfort. By keeping the area protected and dry, you are giving your body the best environment to heal perfectly.